What is Abreva and how is it used? Abreva is a prescription medicine used to treat the symptoms of cold sores, fever blister. Abreva may be used alone or with other medications. Abreva belongs to a class of drugs called antivirals, topical. It is not known if Abreva is safe and effective in children younger than 12 years of age. Dosage and administration. Adults and children 12 years or over. Wash hands before and after applying cream. Apply to affected area on face or lips at the first signs of cold sore, fever blister. Tingle. Early treatment ensures the best result. Rub in gently but completely. Use 5 times a day until healed. How often can I apply Abreva? Abreva should be used 5 times a day until the cold sore is healed. Apply it directly to the cold sore at the first signs of a tingle, redness, bump or itch for best results. Warnings. For external use only. Do not use if you are allergic to any ingredient in this product. When using this product, apply only to affected areas. Do not use in or near the eyes. Avoid applying directly inside your mouth. Do not share this product with anyone. This may spread infection. Stop use and ask a doctor if a cold sore gets worse or the cold sore is not healed within 10 days. Keep out of reach of children. If swallowed, get medical help or contact the pollution control center right away. What are the possible side effects of Abreva? Abreva may cause serious side effects, including cold sore gets worse or is not healed within 10 days, rash, itching, swelling of the face, tongue or throat, severe dizziness and trouble breathing.